Stephanie Barry. I'm the PA student here today. Can I just get your name and your date of birth?
Michelle Trang, 11/09/1995.
Okay. Before we start, can I get your preferred name and your preferred pronouns?
Michelle and she, her. What about yours?
She, her.
Okay.
Okay, so we're going to go ahead and start our exam. Do I have your consent to continue?
Yes.
Okay, let's go.
Hello, good morning. How are you doing today? I'm so good. All right, well, I'm Stephanie. I'm the PA student here today. What's your name?
Michelle.
All right. What's your name? My name's Stephanie.
Oh yeah, you told me.
Nice. All right, so do you know why you're here today with us?
No.
Okay, well, we had some family members recommend that you come in. We're going to do a quick little mini mental state examination just to see how you're doing and how you're feeling. Okay, we're going to go ahead and start. So, do you know what year it is?
2035. We live in the future.
Yeah. What season are you in?
Summer? Okay, spring.
Spring?
Fall? What do you think?
You tell me.
Fall.
Fall. Okay.
Time's not real.
Yeah, that could be it. What's the day today? What's the date?
Today is the 7th.
Okay. And do you know what day of the week it is?
Thursday? Friday? I love the weekends.
Me too.
Time's not real. Time is not real.
Last question.
Time is not real.
What month are we in?
June?
June. Okay.
July? August? Like I said, time is not real.
Okay, let's move on then.
Okay.
What state are we in right now?
A state of distress.
Okay. What country are we in?
USA.
Okay. And what city are we in?
Palace.
Okay. Do you know where we're at right now?
In a spaceship. No, I'm just kidding. The clinic. Duh. Do you know where we're at?
The clinic.
The clinic.
Do you know what floor we're in?
Second floor.
Okay.
I've bungee jumped before. Have you?
I haven't.
From the 78th floor. It's like the
Oh, wow.
same thing that we're in right now. The 78th floor.
That's very impressive. Okay. So we're gonna go ahead and move on. I'm gonna name 3 objects, and I'm gonna want you to repeat them.
Okay.
So, let's see. Apple,
Apple.
shoe,
Shoe.
dog.
Dog.
Can you say that one more time?
Apple, shoe, dog.
Okay.
Apple, shoe, dog.
All right. And now I'm gonna have you spell world backwards.
D-O-R. No. D-O.
It's okay. It's a hard one. It's a hard one. All right. So now, remember how I told you 3 things earlier? Can you tell me them again?
Apple. Shoe. Cat.
Okay.
No, I'm just kidding. It's dog. I'm so smart. I know it's dog. It's dog.
You did a good job.
Okay, thank you.
Okay, so I'm gonna show you an object, and I want you to tell me what it is.
Okay.
What is this?
Hand sanitizer.
Okay.
I know what it is.
Okay. One more thing. Okay. What is this?
Paper.
All right.
We have to save the trees
Yes, we do.
and the world. I can spell world backwards.
Okay. I'm gonna have you repeat the phrase "no ifs, ands, or buts."
No ifs, ands, or buts.
Okay. And now I'm gonna have you follow these instructions. So you get this piece of paper, take it in your right hand, and then fold it in half and put it on the floor. Okay. All right. So I'm gonna have you now.
Sorry.
That's okay. Open this and do what it says.
Open this and do what it says.
Okay. Okay. So now I'm gonna want you to think of the sentence, make it up, and I'm gonna have you write it down.
Okay.
All right. Thank you. I'm gonna go ahead and show. Okay. So now I'm gonna have you do one more thing. There's this drawing. I want you to remake it on the
Okay.
side right here if you can.
I'm gonna start over.
Okay.
Here you go.
Oh wow, this is an artwork.
Thank you.
All right. Well, that concludes our exam. We're gonna go ahead and get your results, and then we'll come back with you. Okay?
Okay,
Thank you
thank
so much.
you. Thank you.
This is her drawing.
The ethnicity and race of my patient could affect the interpretation of the MMSE regarding their cultural norms, educational disparities, and language barriers. For example, if you have a patient coming in from a culture that is not very accepting of mental disorders, they may have a hard time accepting their diagnosis and also adhering to their treatment plan. In regards to gender identity is really important throughout the whole interaction to make sure that they don't feel disrespected and that they feel accepted in any regard. So this could also lead to distrust in the patient and provider interaction. So it's very important to stay respectful throughout the whole thing to make sure that they feel comfortable to do the MMSE. Social determinants such as low socioeconomic status, lack of health care, or lack of education can also induce stress on the patient, affecting their performance on the MMSE. For example, if the patient knows that they don't have the funding, or after they find out their diagnosis, they realize that they can afford the treatment, they may act differently on their MMSE to, avoid the diagnosis and any further checkups. My patient scored a 19 out of 30 on their MMSE, indicating mild cognitive impairment, which can be caused by bipolar disorder during a manic episode. The first step would be treating their manic episode with lithium or valproate, which are mood stabilizers. Atypical antipsychotics such as quetiapine can also offer modest cognitive benefits. I would focus on the role medication can play in benefiting the patient and also in stabilizing mood. I would make sure that they are consistent with their treatment and they know the importance of staying on the treatment even if they start feeling better. My basic counseling would consist of staying calm, using common terms, and ensuring the patient that bipolar disorder is a mental disorder and not a personal flaw. I would avoid criticism and judgment by being kind and willing to explain any questions that they have. Some of the coping strategies I would recommend would be creating a daily routine, also journaling to recognize these mood patterns, and also using memory aids such as a calendar. I would also recommend activities that would calm them down, such as going on a walk or doing breathing exercises. The lifestyle modifications that I would recommend would be usually 7 to 9 hours of regular sleep, limiting their alcohol and caffeine, and also encouraging healthy eating. For patient education, I would make sure I use visual aids to explain what bipolar disorder is and what a manic state looks like and how it may present. I would also make sure I educate them on the medication and also the common side effects, which include tremors, weight gain, or skin changes. I would also make sure that they know the common symptoms and warning signs that could happen during these medications. In regard to the management of comorbidities, I would screen the patient for any substance abuse disorders and also check their past medical history to see if they're on any antipsychotics or other medications that could be causing this manic episode. I would make sure that the patient has a way to afford treatment, and if not, I would find resources that are more financially available for them. In order to communicate all these strategies to the patient in a way that is, aware of their cultural background and health literacy and psychosocial needs, I would make sure to ask what they feel comfortable with the most. I would also make sure to explain everything in layman's terms and add visuals if needed. That way they don't feel like they don't know what they're being treated with or what their condition is. I would also make sure that for their cultural background, I would explain any stereotypes and also inform them that family members may not understand, but at the end of the day, that they can always come to us and we will be able to explain what's going on to, put them more at ease and to ensure that these medications are not going to change the type of person that they are, but if anything, they're going to benefit them and make them feel more balanced again. I'm also going to make sure that they have access to everything that they need and ensure that they feel comfortable sticking to their treatment plan and also clearly understanding what to do. So for that, I would make sure that there's a written plan or any notes that they need. That way, when they leave the clinic, they feel like they are knowledgeable in the topic and know what to do next. Throughout my interaction with the patient, I do think I was respectful and empathetic throughout the MMSE exam. My goal was to make sure I did the MMSE correctly and also proceeded with the whole exam despite how the patient would react or how they would do the task. The patient didn't do all the tasks correctly, so I did my best to stay calm and not make any remarks to make sure that they felt comfortable and that they didn't notice that they did them incorrectly. Therefore, I could get a better score of their MMSE and they wouldn't change anything. I think in future patient interactions, I need to practice more active listening. I feel like you learn a lot more from a patient by listening and really hearing how they truly feel and any thoughts in their minds. I do think it's important to do the test correctly and not banter too much, just to, save some time and make sure that the test gets done. But I think after the test is done, that's a very good time to, get to know your patient better and also lead to a better diagnosis and treatment plan for them that's more specific to them. I hope in the future I can, better those skills and make sure that my patient always feels cared for and that they feel heard and that they feel understood.